Do you wake up to pee every single night? The simple 60-second exercise may help you sleep longer. What if spending just 1 minute a day could become part of a healthier bedtime routine? While this exercise isn't a cure, it may help strengthen the muscles that support your bladder. When practiced consistently over time, point 1. Understand why you wake up at night. Waking up to urinate once in a while is common, especially as people get older. However, waking up multiple times every night is known as nocturia, and it can have many different causes. Sometimes the bladder becomes more sensitive with age. In other cases, the body produces more urine during the night, or the bladder simply cannot hold as much urine as it once did. Certain medications, drinking large amounts of fluids before bed, diabetes, sleep apnea, or an enlarged prostate in men can also contribute. Understanding the cause is the first step toward finding the most appropriate solution. Point 2. Try this simple 60-second exercise. A gentle pelvic floor exercise, often called a Kegel exercise, may help strengthen the muscles that support your bladder. Sit or stand comfortably. Tighten the muscles you would use to stop the flow of urine. Hold for 5 seconds, then relax for 5 seconds. Repeat this 6 times, taking about 1 minute. Avoid doing this exercise while actually urinating, as healthcare professionals do not recommend making that a habit. Like any muscle exercise, consistency is important. Many people notice improvements only after several weeks of regular practice. Point 3. Watch your evening fluids. Try not to drink large amounts of fluids within 2 to 3 hours before bedtime, unless your healthcare provider advises otherwise. Point 4. Reduce caffeine before bed. Coffee, tea, cola, and other caffeinated drinks may increase urine production and irritate the bladder in some people. Point 5. Empty your bladder before sleeping. Using the bathroom right before bed may help reduce the chance of waking up during the first part of the night. Point 6. Stay physically active. Regular walking or other light exercise supports overall health and healthy circulation. For some older adults, staying active may also help reduce nighttime urination by improving fluid balance throughout the day. Even a short daily walk can be beneficial when combined with other healthy habits. Point 7. Check your medications. Some medications, especially diuretics or water pills, are designed to increase urine production. Never stop taking prescribed medicine on your own. Instead, ask your healthcare provider whether changing the time you take it could be appropriate. Point 8. Keep a bladder diary for several days. Write down when you drink fluids, how often you urinate, and how many times you wake up at night. This simple record can help your healthcare provider identify patterns and recommend the best treatment. Point 9. Don't ignore poor sleep. Conditions such as sleep apnea can sometimes contribute to nighttime urination. If you snore loudly or feel unusually tired during the day, discuss these symptoms with your healthcare provider. Point 10. Know when to seek medical care. If nighttime urination is accompanied by pain, burning blood in the urine, fever, or sudden severe symptoms, seek medical attention promptly. These signs may indicate an infection or another condition requiring treatment. Point 11. Be patient with progress. Pelvic floor muscles become stronger gradually. Just like any other muscle in the body, most people need several weeks of consistent practice. Before noticing meaningful improvement, don't be discouraged if results aren't immediate. Point 12. Maintain healthy daily habits. Eating a balanced diet, staying active, managing your weight, and controlling conditions such as diabetes or high blood pressure can all support better bladder health over time. Point 13. Talk with your healthcare provider. If frequent nighttime urination continues, despite healthy lifestyle changes, schedule a medical evaluation. Identifying the underlying cause is often the most effective way to improve your sleep. Point 14. Small changes can make a difference. Simple habits may not seem dramatic, but together they can have a meaningful impact. A 1-minute exercise, smart fluid timing, and healthy routines may help some people experience fewer nighttime bathroom trips over time. Point 15. Make better sleep your goal. The goal isn't simply to wake up less often. It's to enjoy deeper, more restful sleep that helps you feel refreshed during the day. A simple 60-second pelvic floor exercise, combined with healthy bedtime habits and guidance from your healthcare provider, may help support better bladder control, Remember, if your symptoms are severe, sudden, or continue to worsen, don't ignore them. Seeking medical advice is always the safest step toward finding the right treatment for your individual needs. Point 16. Pay attention to your sleep routine. Your bedtime habits can influence how often you wake up during the night, going to bed at different times. Using electronic devices late at night or having an uncomfortable sleep environment may affect sleep quality. When your sleep is lighter, you may wake up more easily and notice bladder signals that you might normally sleep through. Creating a consistent bedtime routine, keeping your bedroom comfortable and relaxing before sleep may help your body prepare for deeper rest. While these habits may not directly stop nighttime urination, they can support healthier sleep patterns and make nighttime awakenings less disruptive. Point 17. Strengthen your bladder support. Over time, the muscles around your bladder play an important role in controlling urine flow. Like other muscles, they can become weaker when they are not regularly trained. Gentle pelvic floor exercises are designed to support these muscles and improve their strength gradually. However, doing too many repetitions or squeezing the wrong muscles may cause discomfort. Focus on quality rather than quantity. A few controlled contractions performed correctly each day may be more helpful than rushing through many repetitions. If you are unsure whether you are performing the exercise correctly, a healthcare professional or pelvic floor specialist can provide guidance. Point 18. Avoid common mistakes that may affect your progress. Many people try to solve nighttime bathroom trips by simply drinking much less water. Throughout the day, however, becoming dehydrated can create other problems and may not solve the underlying issue. Your body still needs enough fluids to function properly. The goal is not to avoid drinking water, but to create healthier timing habits. Staying properly hydrated during the day while reducing large amounts of fluid close to bedtime may be a more balanced approach. Also, remember that everyone's situation is different. What works for one person may not work for another. Point 19. Listen to your body and track changes. Improving bladder habits takes time, and paying attention to your body signals can help you understand what works best for you. Notice patterns such as what you drink in the evening, how well you sleep, and how often you wake up. Small improvements can happen gradually, so tracking your progress can help you recognize positive changes that might otherwise go unnoticed. Remember that the goal is not perfection. The goal is supporting better sleep, maintaining independence, and improving your overall quality of life through healthy habits and informed choices. Thank you for watching. If you found this video helpful, consider sharing it with someone who could benefit from it. Don't forget to subscribe, and turn on notifications for more evidence-based health tips to help you stay healthy and age well. See you in the next video.